Hi, good evening.
I just don't know if the lighting is enough here. Good evening, everyone. Good evening. Good evening. Can you hear me? Can you?
I can hear you.
Okay. All right. All right. Thank you. Thank you. But I can get feedback. I don't know why I'm getting feedback in between. Okay.
Sorry, I want to ask a quick question before we start. So, I'm using my mobile phone, but I don't know how can I share my screen using my mobile phone? Because I don't seem to see anything here that
Okay. So on that your screen, you will see mute, you will see stop camera, and then there is also setting and present. Just click on the present for you to be able to present. And if you can just send it to me on WhatsApp. I can help you do that
I
from my
have
end.
settings here. Don't have to present.
All right. Anyway, we are live, Zainab. So I you can just send a private chat for any conversation, any issue that you have, in case you can navigate the presentation button. So, hello everyone. I cannot really know how many people are on the live stream, but if you are, just let's see your emoji. Let me see that we are all live and direct. Yes. So I can see Ogundele Kende. Thank you for joining us. Good evening. Um, Michael Gloria is also live. Thank you for joining. Yetunde Aronse. Sorry if I can't pronounce it well, but Yetunde, welcome. Thank you for joining. Yeah, I need more emojis. So if I think at this point, I want everyone to go to the community and, let's just go and make one big noise and tell them that we are live. Let them join us, right? Because everybody needs to be a partaker of this. I don't want anybody to come and rewatch or, watch the replay of this impactful webinar that we are going to have today. So let's go back to the community and disturb them, tell them, drag everybody to come join this live stream webinar. So let's do that for like 1 minute. Yes, just minimize your YouTube page and then go to the community, the WhatsApp community, put on your status to for them to join this live stream. Click on the link and post on your status. Yes, and also disturb all the women in the community. Let them come and join us. Yes. All right. So why others will join us, I think we are just going to go straight into today's webinar because we really don't want to waste anybody's time. It's festive period and we all have a lot of things to do. So I would start today's meeting. For people that join, I think I will let us even have like a feedback and summary. Let's talk about yesterday's webinar. If you were live yesterday, I mean, you joined the yesterday webinar, put it in the chat box. Just, put what was the most exciting thing that you took away, like something you learned yesterday from the webinar. I just want to get a feedback. Put it in the live stream. If you joined, you can put an emoji just to indicate that you were live yesterday and you really enjoyed, or the webinar was really impactful. So let me see. I'm waiting. The chat box is not buzzing. What is going on? My women, eh? People are, I don't know. Do we need to go and drag more people? I mean, between our let me know what's going on. So let's talk about yesterday's webinar. It's very important because most of the time we need to refresh our memory back to the things that we learn, so that it's not just going to end in just yesterday and then we pick up another thing today again. And at the end of the day, by the time we ask, what did you learn in the 3 free days webinar? Because this webinar should be, we are supposed to add a price tag to it, but then we are giving it out for free. So we want to know if people are really getting impact from it. You're getting the knowledge, getting the necessary things that you need to know, because it's not every time you have access to the the founder. Yes, so there's like more or less like big opportunities for you to ask any question that is burning in your heart. And I think I'm going to say that if you have any question in the course of this webinar today, just put it in the chat box. I'm going to pick it one after the other for the speaker to be able to answer all your questions at the end of our presentation. Yes, so since people they don't want to tell us what they learned yesterday, I'm not going to take it personal, but then I'm going to take it personal too, because I will drag everybody in the community anyway. So let's start today's webinar. Yes, so I will drag everybody in the community anyway. So let's start today's webinar. Me too. So sorry. That's a feedback from my. I'm trying to navigate my phone and join the live and see what's going on in the live session. All right, that's fine. Okay, so let's start today's webinar. Today is going to it is one, like, two topic jam packed to a day, which, like, I don't know how to explain it, but it's a lot. So if you are here live, right, I need you to pick your book and your pen, because you are going to write a lot of things down today. You are going to document, jot a lot of information in the course of our presentation. You are going to jot a lot of things down. So we are going to kickstart today. We our speaker is Zainab Okunla, and I know that she's live here with us. Zainab, please, can you turn on your camera if you don't mind? Okay, so sorry, I can see.
Okay.
Can you hear
Can you
me?
hear me? Yes, I can hear you. Can you hear me too?
Yes,
Yes,
definitely, I can hear
definitely. I
you.
can hear
Thank you
you.
for
Thank you
joining.
for joining. So,
All right, I don't know.
all right. I don't know. Um,
Are you connected to two
are you
phones?
connected to two phones? What do you say? Hello, I can't hear
I'm
you.
getting
I'm
feedback.
getting feedback. Yeah, I sent you the documents, but can I share my screen like this?
Don't worry, I'm going to
Don't
share
worry,
the
I'm going
screen
to
for
share the
you.
screen for you. All right.
All right,
All
so
right.
so Zainab,
So
before we
Zainab,
start,
before we
I would
start,
like you
I would
to,
like you to,
briefly
briefly
introduce
introduce
yourself
yourself
to the
to
audience.
the
Just
audience.
introduce
Just
yourself to
introduce
us,
yourself to
the people
us.
that.
All right. Hello everyone. My name is Zainab Okola. I am a registered nurse midwife. with about 3 years of working experience. So I don't want to go into details. I think that's briefly a bit of information about me. It's just stuff like that.
All right, thank you so
All right,
much,
thank you
Zainab.
so
As
much,
you
Zeno.
can,
As you
I
can,
don't know, so
I don't
sorry.
know,
I
so
can get
sorry. I can't
feedback.
get feedback.
I don't know, maybe I'm the only
I don't know,
one, but
maybe
I'm
I'm the
getting
only one.
feedback.
I'm getting
So if you're
feedback. So
connected
if
to two
you're connected
phones,
to two phones,
please disconnect.
please
I'm so
disconnect.
sorry.
What do you say? I can't hear you.
Are you connected to
Are you
two
connected to
phones?
two phones? No, just one phone. Okay.
Okay. I'm getting feedback.
Feedback. How about now?
Um,
Um,
okay. Still the same
Still
though.
the same though.
All right,
All
so
right,
let's
so
just
let's just
continue.
continue.
All right, so we
All
have
right,
more
so we
people
have more
join
people
us.
join us.
Muturayo, thank you for
Muturayo, thank you for
joining.
joining.
Aminat,
I mean, Nat,
Zinobu,
do not
thank you for
do. Thank you
joining.
for joining.
So if you're
So
just
if you're
joining us,
just
we
joining
gave an
us, we give an
assignment to people
assignment
that
to people
join.
that
Put
join.
we
Put
want you to
what you want
post
to
in
post in,
post this on your
post this on
status
your
for people to
status for
join
people to
us
join
live.
us live.
So just few
So
minutes, you
just few
can log
minutes, you
out
can log
and log
out
in
and
back
log
just
in
for you to
back
be able
just
to
for you to
post
be
it
able
on
to
your
post
status,
on your
or
status,
put it
or
in any
put it
community
in any
you
community
have that
you
you think
have
that
that you
the
think
women are
that
going
the
to
women are going
benefit
to
from
benefit
this.
from this.
So just put it
So
there,
just be there,
then come back and
then
join
come back
us.
and join us.
All right, so we
All
would
right,
start
so we'll
now.
start now.
Okay,
Okay,
so
so
so if you're just
so if you're
joining,
just
please put
joining,
an
please put an
emoji.
emoji.
Zainab, I want to
Then
chat you with
about
my
to chat
phone.
your phone.
Please check your
Please
message.
check your message.
I'm still live
I'm
with
still
you. I'm
live
trying
with
to
you. I'm trying to
present,
present.
so trying to
Okay.
navigate
Trying to
around
navigate
it.
around it. All right.
All right, can you
All
all
right.
see
Can
my
you all see
screen?
my screen?
If you can see my
If you can see
screen,
my
just put an
screen, just
emoji
put an
how
emoji
let me
how
know that
you
we're
know
on the
that
same
we're on
page.
this page. I can't see your screen.
Oh my god.
Oh my god.
Okay. I guess it's still
I
coming
guess it's
up.
still coming up. Yeah.
Can you all see my
Can you all
screen?
see my screen? No, not yet.
Can you see my
Can you
screen
see my
now?
screen now? No.
Okay. I have to use another meter.
Hi, Sarah. Is there any issue with the document or something?
All right, so
Alright,
sorry.
so sorry.
Realize that
Realize
this
that
cannot
this
take
cannot take
the
the
documents into the
documents into
account. I
the
need to
account.
convert it.
I can't hear you. You're
I need to
breaking. I
convert
need to convert
the.
the. Okay, you want to convert the document.
Please,
Please,
apologies for the
apologies for
delay.
the delay.
Experiencing some technical
Experiencing some
issue.
technical issue.
All right, so Zainab,
All
I
right,
think
so
you should
Zainab,
try
I think
and
you should try and
present because I'm
present
still
because I'm still
struggling with
struggling
converting
with
it. So,
converting it. So, what do you say?
can you try to
Can you try
present?
to present? Yeah, I can't find anything like present on this my end here because not being able to present.
Try. Mhm. Can you see? Oh, let me confirm something. All right, so the screen is up. Thank you. Zainab, can you hear me? Hi, everybody. Zainab, can you hear me? So, if you're just joining us, please drop an emoji. We are going to kickstart in the next 1 minute now. Apologies for any delay. We been experiencing some technical issue. Hi, Zainab, can you hear me? Okay, so I guess it's a network issue because we're trying to connect the speaker back. Apologies once again for the delay. Oh, this was not foreseen. Okay, so we'll be starting soon. I guess she's trying to join back. Please kindly bear with us. Okay, so for all right, so let's start. While we are waiting for the speaker to come up, to join us live on in the studio, I think we are going to start. So today we'll be discussing about diabetes during pregnancy and also family planning. And I know that we are all excited to learn. Everybody, I'm sure that a lot of people have questions about family planning. The last webinar, the last outreach we went to, we heard so much, so many things about the new practice that some women do in order to prevent pregnancy, family planning method. So many people have question about the family method that they can use or that will be suitable for their body. So many questions, but all those questions, I want you to save your question, drop it in the comment box so that we can pick it once it's time for questions and answer. And also, we're going to talk about diabetes during pregnancy. There are conditions that comes with pregnancy, and that sometimes someone already have diabetes, and then the person is pregnant. These are the things we are going to cover today. So still waiting for the speaker to join us. But while we are doing that, if you just joined the live, please kindly drop an emoji so we can, know that you are live with us, and we can, mark attendance, because at this point we want to mark attendance on the live. Yeah, we want to mark attendance today. There is free gifts for people that join us from the beginning of the webinar till the end of the webinar. I mean, all through the webinar, not like today, so that we can appreciate everyone that joins. So, oh wow, I can't pronounce this name. Madrasatu, welcome. Thank you for joining. Thank you. Welcome to the webinar. Yes. So
You can just show the screen, then I'll just present with what I have on my.
all right, Zainab, I guess you've been able to join. Thank you. All right. So, without wasting much of our time, I think we should just dive straight into today's topic. I would leave the floor for Zainab Bukola to continue from here. Thank you.
Hi, good evening, everyone. My name is Zaina. Please confirm if you can hear me, please.
Yes, I can hear you. And for others, if you can hear her, just put it in the live box, in the chat box, sorry, comment box, and say, we can hear you. All right, you can continue.
But I think I have a bit of an issue from my end. I can't see your screen. Are you sharing on diabetes so that I can just present using my own document? Because I can't see
Yes,
anything. It's not showing.
yes.
All, all right.
So if you can see my screen, please indicate. I don't know if I'm the only one seeing the screen, but if you can see my screen, kindly just, just put an emoji or say, I can see, we can see your screen, I can see your screen. We need those feedback. So, yes, so I'm sharing on diabetes during pregnancy. So you can start. I would move it according to, the way your pace. Yeah. All right. Thank you, Mutsurayo.
Hello, can you hear me?
Can hear you. We can
All
hear
right.
you. Definitely. Thank you.
All right. So I'll be presenting. Am I audible, please?
You have. Please start. You're audible.
All right, I'll continue. So, um, diabetes. Online. Like I should put my phone on landscape. Okay. How can I do that? Because I don't understand. Maybe it's my.
All right, so apologies for that. I know we all cannot hear the speaker. So while the speaker is still trying to resolve the technical issue she has, I'm going to pick it up from here. So let's go straight into today's topic. We are going to be talking about diabetes during pregnancy. And what exactly, when people say diabetes, what does it mean? Diabetes is a disease condition that affects how your body makes use of sugar, that is the blood glucose. We all know sometimes when you go to the hospital as a pregnant woman, they will tell you you should do your glucose check, right? You should do your blood glucose test. And by the time they check, what are they trying to check? They're trying to check if the sugar, the blood sugar in your system is within the normal range. And if it's not within the normal range, they would know what to do and the medical treatment they need to give to the person. And if it is below, they would also find a solution to it. So we have three major types of diabetes. Are you all, can you all hear me? If you're following, put an emoji. The speaker is going to join us soon and she would pick it up from where I stop. Yes. Can you all hear me? I want to see it. I can hear you. We can see your screen. So I would know that everyone is following. Thank you. So we have three major types of diabetes. The first one is type 1. They call it type 1, and it occurs when the body immune system destroy the cell of the organ that produces insulin. And there is also not enough insulin to act on the sugar in your body system. So that's the type 1 diabetes that we have, the major type of diabetes. So I said the first one is type 1. We also have type 2, and we have gestational diabetes, which is more or less like our focus for today. But then we need to learn the three major types of diabetes that we have. The individual with type 1 will be dependent on insulin all through their life. These are the people that, when you see them give themselves shots. I don't want to go deep into that, but then they give themselves insulin. They take insulin injection because they can't live without that. Their body system cannot produce enough insulin. So we move to type 2 diabetes, and this one occurs due to either the body does not make use of the insulin produced or well, or because the body is resistant to the hormone produced. And this is mostly common in people who are overweight or obese, although the individual will not be dependent on insulin for, like, for their life, for their lifespan, but it would be included in in their management. So their body does not make enough insulin. So it's not like their body does not produce it, but it does not make enough insulin, well, or the body is resistant to the hormone produced. So they also have their own medical management for that. So let's go to gestational diabetes, which is the diabetes in pregnancy. If you are following me, put an emoji. Okay, thank you. You can hear me. Thank you. So, for diabetes during pregnancy, when they say diabetes during pregnancy, you don't have this thing before. It was when you were pregnant that they discovered that you have diabetes. So that's like, pregnancy induced diabetes or something like that. The same way they would say hypertension induced pregnancy induced hypertension, sorry. So let's go straight into our main focus today. So gestational diabetes is diabetes diagnosed for the first time during pregnancy. So by the time you were pregnant, you don't have it. You've never even Nobody has it in your lineage. And then because you went for checkup, continuous checkup, and then they discovered that you have diabetes during pregnancy, that's what they called gestational diabetes, but the short form is diabetes in pregnancy. Like other types of diabetes, gestational diabetes affects how your cells use the sugar, the glucose in your body system. So if you have gestational diabetes during pregnancy, generally your blood sugar returns its usual level soon after delivery. So the diabetes might go on during pregnancy, but it's expected for your blood sugar to return back to its usual level as soon as you deliver. And there's sometimes, but if you had gestational diabetes, you have higher risks of getting type 2 diabetes. So that's I wanted to explain that there's sometimes that the is meant to return back to the normal level, but then it doesn't return. That means that has actually, you've gotten type 2 diabetes just due to the pregnancy. I don't know if you're following me. Please, I want to also see that in the chat box. So most of the time when you go to the hospital, that's the main reason why they keep checking your sugar level, just to know that everything is in check, and if they need to put you on treatment as soon as possible. So let's talk about the symptoms of diabetes in pregnancy. How will you know if you have diabetes in pregnancy? How do you want to confirm that? We sometimes say, oh, during pregnancy, so many people will give you advice, give you sorry, they'll give you advice during pregnancy, tell you if this is this is that. I don't know if anybody have experienced that, but majority of us have experienced it by, so many people giving you advice during pregnancy. It now depends on you. I think it's best you pick the advice of your professional um health worker to be able to. And even with the health workers, you have to know how to filter. The same way we had so many things during the outreach, some women say, oh, is the true is some health workers in the primary health care board that told them to do this, that told them to do that, but then they are not medically, they're not good advice when it comes to medical aspects. It maybe it's just part of them, but then you just need to know how to filter the advice you will take. So the symptoms of diabetes during pregnancy. Most of the time, gestational diabetes doesn't cause noticeable signs or symptoms. But if you are having symptoms such as increased taste, you're always tasty, you want to take water. Like, sometimes it's to the extreme. Those are the symptoms you need to look out for. More frequent urination. We know that pregnant women actually have frequency in their urination. They urinate any small thing because their stomach, their bladder, their bladder cannot really take much urine. You see them, they just want to pass urine. But when it comes to more frequent urination, you need to go to the hospital and you need to see a medical practitioner, I mean your doctor. Speak to your doctor about your symptoms. Then you should also visit your care provider or your midwife for complaints. So you have to complain to them, oh, you are always having increase in taste, and also there is frequent urination. So we'll move straight to causes of diabetes in pregnancy. But before I would get to this point, we've been talking about diabetes. Tell me, how many types of diabetes do we have? What are the major types of diabetes that we have? Put it in the chat box. All right, so I'm waiting. I don't know. Do we still have women on this call? I just asked a question. How many types of diabetes do we have? I need you to put it in the chat box. I need you to put it in the chat box. How many types do we have? I just need to know that we are all following. Put it in the chat box. Let me know that we are on the same page. Yes, I'm waiting. But why I'm waiting for you to put how many types, the major types of diabetes that we have. Put it in the chat box. How many, how many, how many? So let's move to causes of diabetes in pregnancy. The causes of diabetes in pregnancy is unknown. Nobody knows why it comes, why some people, have that, the causes. Although, according to some researchers, you can have gestational diabetes if you are overweight before pregnancy, which is why it is important to monitor your weight prior to and while you're pregnant. And that's the main reason why. So sometimes when you go to the hospital and they're like, oh, madam, come and check let's do your vitals. And I'm like, I did this yesterday now. Why do I want to do it again today? Why are you people stressing me? I'm not checking my weight today. Oh, it is something, I just want to see the doctor. Let me just go and, oh, thank you, Miracle. We have three types of diabetes. If I wanted to, I'm sure that by the time I want to ask now that, oh, what are the types? If you know it, put it in the chat box. I just need us to know that we are all following. What are the types of the major types of diabetes that I mentioned? I mentioned three types, which you all got it. But Raya, thank you. Thank you for answering the question. We have three types. And what are the three major types of diabetes that we have? So I was saying that sometimes some of you, I know hormones gets over some pregnant women. By the time they tell them check, even aside from you even being pregnant, it is very important for us to know some vital information. I mean, some vital information about your health. By the time somebody asks you, what's your weight? I can tell people that this is my weight because I check it almost every time. When was the last time you checked your blood pressure? When was the, oh, thank you, Miracle, type 1, type 2, gestation. Miracle, you want to collect all our gifts, but it's fine. Thank you for answering the question. So I was saying that sometimes when they ask you when was the last time you checked your blood pressure, some of us cannot answer because they're like, I'm not always sick now. Why do I want to check it? I'm not sick. When was the last time you checked your blood sugar level? Auntie, I know nothing do me now. Why do I want to check it? When I go to the hospital, maybe when I have malaria, I will check it. Just they can ask me, oh, I think you need to run some tests. You need to do some tests, then you'll be forced to do it. But these are essential things that you can just walk into your healthcare, the hospital where you use, and tell them you just want to check. And if you have, try and get the apparatus at home, have it so that you can check it periodically. But let's go back to what we were talking about. So, research has shown that if you are overweight before pregnancy, which is why it's important for you to monitor your weight prior, and while you are pregnant, you might have, diabetes during pregnancy. Another cause of diabetes in pregnancy is due to hormone. During pregnancy, the changes in your hormonal level can make it harder for your body to process blood sugar effectively. So sometimes it is due to hormone. I asterisk all this because they are important information. So when I say the causes of diabetes, it is unknown, but then overweight can cause it. Hormone can also be another factor that can, be a risk factor for diabetes in pregnancy. However, if you're at average risk of having diabetes, your healthcare provider carry out a screening test during your second trimester between the 24th and 28th weeks of your pregnancy, just for them to be able to detect if you have diabetes in pregnancy. On the other hand, if you're at high risk of diabetes, for example, you are overweight or you're obese before pregnancy, you have a mother, or there is a family lineage or history about diabetes, or you've had gestational diabetes during your previous pregnancy, your healthcare provider would also assist you with the test you need to do in the early phase of your pregnancy, like at the first prenatal visit. So we'll move to. So it's also important for you to check your body mass index. When you go check your weight, you can tell the nurse checking your vitals that you want to know your BMI. For every woman, we also need to know our BMI. So we would move to how your care provider can help you diagnose diabetes. But before I move there, how many symptoms did I, talk about? What are the symptoms of diabetes in pregnancy? I need to know we are all following. What are the symptoms? Is even there? This is like expo that I'm giving people. So, what are the symptoms of diabetes in pregnancy that I mentioned? I just want to do a recap. It's important, but then we don't have much time. If you know it, put it in the chat box. I want to know that my women are following me because I know that we have brilliant women in the community. We have brilliant people that joined me today because we are all here to learn. So, Also, let's talk about the causes of diabetes, the risk factor that can, cause diabetes during pregnancy. If you know it, put it in the chat box. What are the things you think can, be a risk factor for any woman during pregnancy for her to have diabetes? Put it in the chat box. I mentioned I don't want to give a spoke, but let's move. So, what are the things your care provider can, how they can help you diagnose your diagnose diabetes during pregnancy? For them, firstly, they need to, do a screening, which include initial blood test, the glucose test that they need to check, um, and also they would have to check. There are screening that they would do during pregnancy just for them to be sure, do a thorough findings to know, to check for diabetes during pregnancy. The use of glucometer too to check your blood sugar, blood glucose level, which is the one they would puncture your hand, and check the glucose level in with a glucometer. Then also their test, like the still the same thing. So there are also the normal range and the range that you need to also check out for. So for the normal blood glucose level, for fasting blood sugar means that you've not taken anything before doing it, doing the blood glucose test, and is within 70 to 99 milligram per DL. And for random, your blood sugar should be between 125 milligram or lower, depending on the last time you ate. So, how can you manage your blood sugar level? Managing your blood sugar level helps, to keep you and your baby healthy, and it's very important for you to also follow all due process every care, any advice that you've been told at the hospital. I think it's very important for all you to also adhere to it. Firstly is lifestyle changes. Lifestyle changes goes a long way. You are what you eat. How you eat and move is very important part of keeping your blood sugar level in a healthy range. Your health provider usually don't advise losing weight during pregnancy. Your body is working harder to support your growing baby. So, but then they can also help you set weight gain goals based on your weight before pregnancy. Lifestyle changes include healthy diet. Eat good food. Healthy diet focuses on, your fruits, vegetable, whole grains, lean protein, foods that are high in nutrition, um, nutrients, and also fiber, and also low in fat and calories. And also you have to limit highly refined carbohydrates, including junk sweets. We might be forced sometimes, cravings might want to crave us. We might want to adhere to all our cravings. Thank you, Ramotu. It's two symptoms. Thank you. They mentioned two symptoms. Yeah, two symptoms. But there are other things that your health provider would also look out for. So as I was saying, I said that, eating healthy meals, adhering to a healthy diet is it's sometimes not, that easy. When during pregnancy you might want to crave for, a lot of things, but in all your cravings, please ensure that you are trying to balance your diet. Balance it, because lifestyle changes goes a long way. You cannot be treating diabetes during pregnancy and then you find yourself taking a lot of junks, taking some healthy on unhealthy diet. It's very important for you to, streamline what you take to be able to help you manage the condition while you're pregnant. So we move to another ways to manage your glucose level is staying active. Regular physical activities plays a key role in every wellness plan before, during, and after pregnancy. So We are not advising you to do strenuous exercises. There are simple exercises that you can do during pregnancy. And I think you can check our social media page to check. We've once posted, like twice or three times, posted about the exercise that you can do during pregnancy to help you, with physical activities. They are not, it doesn't have to be strenuous. You can easily dance. Dancing in pregnancy is very important, but not like you dance that, it will be too much. But then just check our social media page for that. In addition, regular exercises can help you relieve some common discomforts during pregnancy, including your back pain, muscle cramps, swelling, constipation. It's very important. And I hope I mentioned, fiber is very important too during pregnancy, because, sometimes pregnancy, you can have constipation in pregnancy, and what you take is going to go a very long way. Yes. So aim for 30 minutes of moderate exercise on most days of the week. I know it's not every time you have the energy, you have the strength to do exercise, but the days that where your energy is high, please let's make use of it. And random days you can just take a walk around your community. You don't have to go that far. Take a walk and come back to your house. You can also, I mentioned dancing. You can get a ball, like that ball that they use. You just keep rolling on it. It's also another form of exercise. So you aim for that. And also I would move to also engaging yourself in um non-stressful house choices are also a good form of exercise. You're trying to clean up the house. You're just moving. The physical activities is just there. It's another form of exercise, so you don't have to hit the gym. If you some people do that, but then we're not advising you to hit the gym. So you can do exercise in the comfort of your zone, like in your home, your houses, the things you do. It helps with mobility. Yeah. So another form, how to manage, is your blood sugar monitoring. You have to either go to the hospital for them to check, 4 or more times a day, but then it's not visible. But then if you can get the glucometer for you to be checking your sugar level at home, in case anything goes wrong, you can easily just go straight to the hospital and complain. This is what I got. It is above the normal range. So they can know how to manage you. So medication too. Your hospital would also provide the medication they need to place you on. And so if diet and exercises are not enough to manage your blood sugar level, you may need insulin injection to lower your blood sugar level. But then, or they will prescribe oral medication for you. It all depends on what your health care provider feels is needed for you at that point. So close monitoring of the baby, and it's very important part of your treatment, for them to observe your baby, the baby movement. You also need to observe your baby movement, the baby activity. So your healthcare provider would also help you check your baby growth, the development with repeated ultrasound or other tests. So if you don't go into labor by your due date or sometimes earlier, your healthcare provider would help you induce the labor. But this so follow up after delivery. After delivery, you're expected to check back, come for your postnatal care within the 6 weeks. That's 6 weeks after delivery, so that they can ensure that everything has either returned to within the standard range, or they need to continue the treatment for you. So it all depends on your healthcare provider. If you're following me, yeah, two symptoms. If you are with me, if you're still here with us, please drop an emoji. If you are enjoying today's webinar, drop an emoji. I really want to get a feedback. Let's get to know. How we all on the same page? Yes, 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 yes. My women, we're almost done. Apologies for the delay. Sometimes technical issues happen. So if you're with me, please drop your emoji. I want to know. Are we? Yeah, 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 yeah. Yes, yes, yes. I want to know. Mutsurai, thank you, thank you, Thank you. So I want more emojis, more emojis. If you are here and following back to back, and you at from today's webinar, drop an emoji. Let me know we are together. This is a fire emoji, like fire on. Thank you. Yes, yes. Okay. All right, so I will continue because we don't really have much time. So, effect of uncontrolled diabetes in pregnancy to mother and the baby. So, I would start with to the mother. There is high risk of high blood sugar pressure. There is also high BP can cause preeclampsia. There is also increased risk of cesarean section, so they might need to, you know, do CS, that's cesarean section for the woman. There's also risks for in case if the diabetes is not controlled, it might lead to hypoglycemia, that's low blood glucose. It can also increase the risk of type 2 diabetes in the mother. Then for the baby, there's one thing they called microsomic baby. That's your baby will be overweight, like it will be big. If your baby weighs between 4.5 or more. I've seen babies that weigh like 6 kg during delivery, like it has happened. So then these are the risks to the baby. The baby too might have hypoglycemia, that is, there will be low sugar level after birth. So that's why it's also very important for you to visit a recognized health care. Visit recognized health care. Sorry. Visit a recognized healthcare, because by the time you start patronizing traditional birth attendants, in cases like this, they will need to put the child under strict monitoring to ensure that they are monitoring the baby's blood sugar level. They can't really do that. They will also need to monitor the mothers too. So that's why it's all very important for you to visit a licensed and recognized healthcare provider. Yes. So injury to the baby's shoulder during delivery, might also happen. There is also yellowish discoloration of the baby's skin, that is jaundice. So they need to also monitor the baby for that. Congenital abnormality, that's the heart defects, can also happen. So this is the end of um today. I mean, this topic, we are talking about two things today. I don't know if that's going to be still be visible, but then when it comes to diabetes in pregnancy, we are done discussing about diabetes during pregnancy. If you have any question, please drop your question in the comment box. I want to know, and if you don't have question, probably you just want to say something, drop the comments in the box. Yes, so we are done talking about diabetes during pregnancy. I would wait. Do we have any question? Do we have any question? Do we have any question? Thank you. Thank you. Thank you. I can see your emojis. Thank you. Do we have any question? I'm waiting in case we have any questions so we can tackle that. Any questions so we can tackle that? I just assume that this our silence is no question. No. Do we have any question? I really want to get to know. Tell me What's one thing that you learned from the today's topic? I mean, diabetes during pregnancy. What's one thing that you learned? Something new, something you want to hold on to, that you can at this point you also can also pass knowledge into somebody else. If somebody is saying this, use this, you can advise them. Oh no, it's not like that. That's not what I learned. That's not what I know. This is it. So, do we have any question? I want to know. Let's ask question. No, there's no free webinar again, and by the time you want to ask question from the founder, you have to pay for consultation fee. So ask your question here. She's here live. She would answer your question free of charge. I'm giving people expo, like I'm trying to tell you, but if you ask question now, it is free of charge. She will answer you. So, do we have any question? So much. Do we have any question? Okay, so I just assume we don't have question. So I'm gonna stop presenting, sharing this, and share the next topic that we have. In the next 30 minutes, we should be done with today's webinar. Yes, so I'll stop sharing this. I'm still with you. I'm trying to share the next topic. We are going to be talking about family planning. And I know that, some people are here because of family planning that we want to talk about. And, we're here to deliver. So, trying to share my screen. Please bear with me. Those about the topic we want to talk about family planning. We want to talk about family planning. Can you all see my screen? I don't know. Maybe. Okay. Can you all see my screen? I don't know if this is better. Can you all see my screen? I need to get a feedback, so I'll be sure that you all can see my screen. Don't know which one is better. All right, thank you. Thank you, Life and Direct. Okay, so let's go straight. I don't want to waste much of our time. We'll talk about family planning. We've all heard about family planning. Family planning. What exactly is family planning? If you want to ask a layman, they will tell you is about child spacing. In a simple term, it's about child spacing. It's about child spacing. When it comes to you know government, as I don't even want to go into that. So what's family planning? Family planning is a method of spacing your childbirth. If you want to have just two, and you in for the two children you want to have, you want to space them, like have like 1 2 years after or 3 years after the second one should come in, you need family planning. You need to plan ahead. You need to plan for that. So this is when you and your spouse decide to give space in number and timing of birthing your children. It involves use of various contraceptive method to prevent or delay pregnancy, ensuring that couples can plan their family according to their preference and to circumstances are within that phase. So why is it very important to plan your family? Number one, it helps you to promote the health of both the mother and the child. Child spacing reduce health risks associated with unintended pregnancy. Pregnancy sometimes are not planned, but then there's a way you can plan it. Plan it in the sense that you can plan your family. I mean, plan the child spacing. Plan either not to have the child yet. So this is why it's very important. Another thing why it's important is because it empowers women. It allows women to be able to pursue their education, their career, their personal goals. You've seen situation that sometimes the mother probably is schooling, and within 2 years she already have two. She's still trying to nurse one. That one is not even up to two, and then she's already pregnant. And Nigerians, they'll be like, why is she pregnant again? But then you don't have the right to even question any family. But there are ways they can also space the children to allow them to be able to pursue their education, their career, and also their personal goals. It also helps with economic stability. It helps families to be able to manage their resources effectively, and it helps in controlling the population. I mean, address the issue related to overpopulation. You see some other tribes, sometimes the way their child, they can have like 6 or 10 children in the family, just one woman giving birth to all of them. It's not easy. It's family planning helps to also give the woman space to regain herself in order for her to be able to bet another one. Yes. So what are the method of family planning that we have? This is save time using calendar method. So what are the method of family planning that we have? We have several method of family planning. Firstly, there's some family planning categories into it's categorized into the natural, the temporary, and the permanent method. So the natural is what we all known as the calendar method, that you have to monitor your menstrual cycle using calendar in order to identify the fertile days, the days you are going to be ovulating, and the days you'll be menstruating. Some women don't know how to I'll have to minimize this. Some women don't know how to monitor use calendar method. If you Okay, so we have question. I'm going to treat this question because I already moved to family planning, but we would answer this as soon as we are done. So any question you have, just put in the chat box. We are going to answer all questions together. So as I was saying, I said their calendar method. Some women really want to know how to use calendar method, but they don't know how to monitor it. Some people, they don't even really monitor their cycle. They would be like, when it comes, it comes. They are the ones that you're like, oh, I just saw my period. And you're like, no, you cannot tell me, wait, the period, you did not know that it's going to come or what. Then that's like you not being able to monitor, because you should have like a range. Oh, this week, or within these days I should see my period. And when you don't see it, you can know that something is wrong. Oh, there's sometimes that some people don't even see they don't menstruate, like try they don't menstruate at all for 2 months, and they don't even notice it until when they're like, this thing did not come last month, oh, and this thing did not come. Then they will not start being bothered that, oh, they didn't see it. It's just a way for us to be able to monitor. So calendar method would help you to monitor your cycle. If you have any question, put it in the comment section. Yes, so I will check it. There are also basal body temperature. This involves you monitor your body temperature from the beginning of your fertile period until when there is a slight temperature change during ovulation. We all know sometimes our body temperature kind of increase, like it spikes up during the fertile period, and you need to be able to monitor your body, because your menstrual cycle is about you understanding your body our body system. If you really want to know how this whole thing works, some women used to have, experience some symptoms before they menstruate, and some experience some, during or after menstruation. So it depends on your body. And there is also cervical mucus method, that is, you have to observe the changes in the cervical mucus consistency. So there is, when you are ovulating, for people that are very observant, you notice that the mucus in that comes out your vagina is kind of different from when you are in your fertile period. So for ovulation, it's always tricky. So you need to be able to monitor and observe all these things during pregnancy. We are still talking about the natural method. Yes. So there is also lactational amenorrhea method, that is for it works for nursing mothers who are breastfeeding exclusively. So for mothers who are breastfeeding exclusively, like you're not giving your baby formula, it's just, as the baby demand, you give it to the baby. This helps, for the first 6 months after birth. They usually don't even menstruate. It helps, it's another form of family method. And then withdrawal method, it involves when your male partner, your husband, withdraw his penis when the vagina, when is about to ejaculate, in order to prevent the sperm from entering the female reproductive tract. And so we move to the next method, which is the temporary method. The temporary method is a short-term prevention of pregnancy. The first one is the barrier method, which is the use of condom. We have the male and the female condom. So whichever one that you prefer to use, female too can use condom. So you need to decide with the one you prefer. The condom helps to prevent, the sperm from reaching the egg, from entering into the vagina, and it has to be, they have to wear it in the proper way, because if they don't wear the condom in the proper way, there might be some leakage or, breakage in between, and you will not know. You'll be thinking, oh, I use condom, how did it happen? But we cannot question the condom that they use. Anyway, so there is also cervical cup, and there are also new method. Hormonal method, these are oral contraceptives, use of pills. Some women are placed on, there are several methods. We are just trying to outline the method, and then you will now have to, sit down and think, which method can I go for? And then it also depends, because there's some method that your body system cannot take. So you have to probably switch to another method until you get the desired method that works for you perfectly. I don't know what's wrong with my lightning. Maybe I need to increase the brightness. Okay, better. Okay, so the oral contraceptives, which I said the pills, the pills, that can be used for 30 days, a month, and it helps to suppress ovulation and also prevent pregnancy. Injectables are also used. That's the hormonal shot that is effective for like 1 to 3 months, and there are different types of injectables that you can use. When you get to visit your healthcare provider, your hospital, they would tell you the one you can be placed on. There is also implants. We have the rod that is being placed under the skin, releasing hormones. So there is the one for 3 years, and there is the one for 5 years. That's the Jadel and Implanol. So whichever one that you know that you are comfortable with, either the 3 years duration own or the 5 years duration own, you will go for that. There is also emergency contraceptives. That's the pills taken after unprotected intercourse. But then you don't have to always take it in a like all the time, because it also have its own disadvantages. They call it emergency contraceptive. So you cannot say wait till you do 30 visits and then you use it. you use the emergency contraceptives today, tomorrow or next tomorrow daddy visit, you use again. It's not good because it would actually alter your hormones, and then start noticing a lot of changes in your cycle, so your menstrual cycle. So you have to be very conscious of the way you use the emergency contraceptive. They call it emergency because emergency happen. But I have mentioned the temporary types of method of family planning, which is the barrier, the use of condom, cervical cup. There is hormonal method, which is the oral contraceptives, the injectables, the implants, and also emergency contraceptives. There is also something called, all right, we would answer all your question. There is also something called, uh, sorry, this thing is blocking my screen at chat, please. Okay. There's also something called IUD. That's the copper IUD. It's copper T. It's like a rod that will be placed inside the woman's vagina, very close to the cervix. So, my God, why is this thing? So we move to the permanent method, which is for women. It is tuber ligation. So it is tying or sealing the fallopian tube, and for men is vasectomy, that is the cut or the seal, the 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 sperm, the cord, like, I don't know how to explain it in a lay term, that passes the sperm. So in order for the sperm not to be able to go through and also cause pregnancy. So I think that, okay, so benefits of family planning. To the mothers, we've said it allowed the mother to be able to, it improves the health, it reduces the risks of maternal mortality or complication from closely spaced or high risk pregnancy. For better family management, it allows the mother to be able to plan and provide better care for each children. For career and education opportunities, the mother have the opportunity, the chance to pursue our personal goals and also other opportunities that comes our way. It also reduces stress. It helps to manage, physical and emotional well-being by preventing unplanned pregnancy. So for the family, economic stability, stronger relationship between the family, you can cater child welfare. The parents are able to provide better and better, and also pay attention to fewer children, leading to improved quality of life. Also, it also helps with future goals. The family can save for long-term goals like housing, education, and emergency. And to the economy, it reduce healthcare costs. That is, it also decrease the financial burden on healthcare system by lowering maternal and child mortality rate. Um, it also increase workforce participation, lower dependency ratio, and economic growth. So let's talk about, I know some people have heard so much about family planning. I want us to put it in the chat box. What are the things you've heard about family planning? What are the might you've heard about family planning? And the truth, they've told you family planning, when you do it, you are going to be pregnant. When you collect the implant, you'll be bleeding. When you do this thing will happen. I want to really get to get from you. What are the things you've heard about family planning? Put it in the chat box. We are done with today's webinar. Yes, yes, yes. We are moving on to questions and answer. All right, so I'm waiting. Put it in the comment section. So, Miracle asks, can diabetes during pregnancy on the mother also have effects on the children? Okay, so when you mean on the children, you mean on the children that you've given birth to, or on the child that you are just going to, that you just delivered, that you just gave birth to? So I need to get like the children being diabetic. Okay, so I'll be I would allow the speaker. I think she'll join and she's going to be answering all our questions. Can you hear me, Zainab? But I need to get Zainab. Can you hear me? If you can hear me, please unmute your mic. All right. So let me answer this question. So when you talk about diabetes during pregnancy, you mean on the children. So that's why I said when they give birth to the child, they also need to monitor that child because it comes with either low hypoglycemia. They need to monitor the baby and monitor the baby even after delivery, probably within 72 hours of birth, to be sure that everything is clear. But then for the children, if you Miracle, are you still on the live? I want you to break this down because I'm trying to get your question on the children, in the sense that for all the children you gave birth to, that means there is a family history of diabetes. Then they need to monitor the children for diabetes. Yes, that's gestational, no, juvenile diabetes. They call it juvenile diabetes, and it has to be monitored. You have to seek health care, go to the hospital for them to, initiate the treatment for them and place them on treatment plan. Yes. Do we have any question? Do we have any question? If you are still here, please drop an emoji in the live box. I want to get to hear from you. Drop an emoji. If you are still here, drop an emoji. Do we have any more question? Because we are trying to wrap up the webinar for today. Any more question? Any more question? All right, so we don't have any question. We would have to end today's session. Thank you so much for joining. Thank you for joining today's webinar, and we cannot wait to see you all tomorrow. Yes. Sorry, I'm still with you. So thank you. Do we still have more questions? They said I should still hold on. Yes. Tomorrow we have more exciting things to talk about tomorrow, and I know that you will not want to miss tomorrow's session. Yeah, tomorrow webinar. Please make it a time for you to come. Invite your friends, invite women that you know that is going to be beneficial to. Invite them, let them come and join us and learn. We want to impart into people's life. Tell them to join us live tomorrow, same time, 7 o'clock. And also, if you have any question, you can jot it down so you can ask in tomorrow's webinar during tomorrow's session. Thank you so much for joining, and do have a nice evening, a very good rest, yes. And if it is morning in your time zone, do have a nice day. Bye.